Pleased to see you again. Today we're talking about the peer enhanced e-placements experience. We're more than a year into this now, and so there's all sorts of implementation and impact going on. So I'm delighted to tell you I have Helen Lowes with us. And Helen, perhaps you tell us how you've been involved in this very collaborative process, not only with us, but also with colleagues, to tell us what you've been doing, particularly with your profession, first of all, which is the operating departments practitioners. So over to you, Helen.
Thanks, Gilly. So I work for Sheffield Teaching Hospitals and I'm a learning and development manager. One of my key roles is to manage a team who manages student placements at the Trust. But I am an operating department practitioner by background, and I work for the College of Operating Department Practitioners as well. So when my initial involvement in PEEP came about by coming to one of the events, I think it was in June of last year, where I acquired an acquisition package for the Trust. I then noticed that there was some activity online, on Twitter, on social media around operating department practice, and being a big advocate for the profession and trying to sort of move the profession forwards. I wanted to be involved in that, so contacted Lisa through social media, and became part of the sort of the ODP contextualization, where we did a deep dive into the profession to see kind of where we were at in terms of placements, what we could do at the time to respond to the COVID situation, but also think more long term about placements for ODPs and the development of the profession.
So can you tell us a bit more about what you mean by deep dive, and how you experienced it and what we actually did?
There was a number of people from around the country who were interested parties from the ODP profession. We had an illustrator at the time as well, who sort of created some imagery around the things that we were talking about and the things that were most important to the profession. We talked about the history of the profession, we talked about where the profession is at the moment and the future of the profession driving forwards, and sort of considered where the peer enhanced e-placements could come into that. And there was a lot of conversation around certain areas that aren't always accessible to students and to learners, and to create parity from a national point of view. In London, there might be very much focused on, say, anaesthetics, where up in northern areas, so where I am in Sheffield, they do a breadth of placement experiences. Some trusts may have neuro intensive care, for example. How do you manage to make sure that all students being trained as operating department practitioners might get some experience of that if it was as part of the curriculum?
Yeah, so those who are interested in that visualization experience, there's a couple of videos on here that you can have a look at. So did you enjoy actually having the visualization? Did it help you, I think, to work with colleagues and understand the future for the profession at all?
Yeah, I mean, there's been some significant changes for the profession over the last 4 or 5 years. So we became an allied health profession in 2017, and then very recently, actually, in the last couple of weeks, we've now gone to an all degree profession. So we're moving towards that. So it was nice to review kind of the past, but also finding now it's really important to see where we are as a profession and what the future holds, and actually to have people around the table who could draw on like their experiences and where the profession might want to go in terms of its traditional route in perioperative services. And actually with COVID, it's now around critical care, ITU and other areas. It was good to draw on some of that and how we can then develop these virtual placements to draw that through the curriculum and look at how it might affect future training.
So to be clear, are you saying through doing it entirely online, using the PEEP model, it helped you to address some of those things which would have been more difficult or even sometimes impossible to do in the traditional way.
Yeah, and I think it brought people together from a national point of view, which doesn't often happen. So people could talk about their current experiences, what they were going through with COVID, and share those challenges and draw, come. I mean, there were some solutions to it because people did start to implement the PEEP, but also it started a conversation, certainly with the college. So we're looking at national repository, potentially of sharing peer enhanced e-placement models, so that again it can provide that parity across the national training programme.
You've
So,
talked about the sort of national point of view, Helen. Thinking about you at a local level now, you've talked about being involved in that PEEP acquisition experience. What has that meant for you at a local level and the impact it's having around Sheffield?
In terms of just ODP or other professions as well?
I think initially ODP and then the broader
Yeah.
impact as well.
So from my initial involvement and getting the acquisition package, we then moved and we had the a workshop. So I took that to a trust exec group, presented at the exec group, and sort of asked around AHPs who might be interested in doing that. And I think we had 6 professions that came forward. And at that group, I represent operating department practice as it stands. And then we sort of drew in the HEIs, because I believe that we were the only trust to have got one of those PEEP acquisition packages. And I worked quite closely with one of our HEIs in the local region to develop the PEEP package, but they very much took that on, and we supplied some specialist people to give that depth of teaching, and the depth of understanding, and those were the things that we'd identify. So one of the things was around bariatric surgery, and not all students in this area might get to see bariatric patients, and so we had specialists to come in and talk to all the students around bariatric patients and bariatric surgery. So again, it provided that parity. So it's allowed us to deliver, or the university to deliver the PEEP, and the plan is that PEEP will remain for each year, for the future, really, at the moment. So I suppose that's been the impact on ODP. It's impacted on some of the work that I do within the trust around work experience for young people as well. So it's influenced the way that we have kind of confidence in delivering virtual workshops, and now we're looking at different leadership placements for school age children, to see what's happening in the NHS, because actual face-to-face placements can't happen at the moment. And then the other professions that came to the acquisition, the workshop, should I say, in January. So we had orthoptists, we had the ODPs, we had occupational therapy, physiotherapy, speech and language therapy, and dietetics. Orthoptists have ran with it, really, and within 2 weeks they were running their PEEP, and I know that they're in a process of evaluating that. And then there's been a lot of learning taken from the fundamental principles and the pedagogy behind that, the PEEP, and they've been applied to kind of the remote placements that we're already starting to develop. I'd say it's also improved collaboration within the trust. I was relatively new in position. It's helped me to get to know people and build up partnerships, and we've actually been successful with some bids, which have allowed us to have sort of technology enhanced kind of placements as well. So yeah, it's been really impactful in the trust.
well, Helen, thank you so much for telling us all of that. I mean, we were blown away by it, really. And I know that you've been an incredible driver, and it must have been a lot of hard work for you, especially where you're trying to change what everyone's done previously. But there's no doubt you've made a massive contribution. So I'm sure both Lisa and I want to say thank you very much. And it's been absolutely fabulous to work with you. And I hope as we gradually creep out of the emergency teaching, that we'll all be able to create some real sustainability into this work for the long term.
And I think that's where I'm at now, is so it's sort of, I've brought it into the trust, we've got it going, it's been successful, but then how do we build on that? How do we move this forward? And I think, I mean, we're in a very different place to where we were last year, although we still have COVID looming, and who knows what the impact of that's going to be. From my point of view, it's about embedding this into kind of the trust and working with the HEIs. And there were some really, really nice things in the initial kind of meetings between the professions around multidisciplinary PEEPs, and there's some really nice ideas which we've not managed to actually implement yet. So that's something that's always sort of sat in the back of my mind. At some point we might be able to bring all the students together.
We know that's a tough call, but I believe you stand much more chance online than you would have done trying to get them all physically in one place. So I hope you keep going on that one. So can I say thank you again from me?
Thank you, Helen.
And thank you, Helen. And for everyone watching, we'll put lots of links, and I hope you'll follow this amazing story. So thank you very much.
Thanks, Julie. Thanks, Lisa.
Thank you. Bye.